I am so excited to talk to our guest today, Joanna Strober from Midi Health. Um, you know, you're talking to menopausal patients every day. We talk about menopause every day. So we're always looking for something new and interesting to share with viewers. And I think Joanna has such a unique and clear perspective on what differentiates her. And one of the things that her and her company, and what struck me, is how much of a focus they have on listening, which seems so basic, but is so critical because you have to remember what the patient wants, even when there's pushback from other parts of the system.
And I really gathered a completely separate perspective that she listens to her providers as well. So we have happy people on each end, and they learn from their providers and from their consumers. So let's listen to Joanna.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited to have today's guest, Joanna Strober, who's CEO and founder of Midi Health, which she will tell us all about. Welcome. We're so happy to have you, Joanna. How are you?
I'm good. Thank you. Very good.
So when you started this company, you were part of the wave that was moving and gathering steam around menopause, and now you're in the center of it as it explodes and crashes on the shore. Talk a little bit about what made you start this. You have a very interesting background in areas related to, children's health and family health. What was the catalyst that started Midi?
So it really was two things coming together. The first was my own experience trying to get good menopause care. And, I obviously, everyone starts like that, but it really was painful. I had the experience of stopping sleeping, going to the doctor. The doctor basically said, go try sleeping pills, but you can't take them very often. I was also having anxiety, and they sent me to therapy. My marriage was struggling. We were going to marriage therapy. No one mentioned menopause or perimenopause to me. So I really struggled for a long time. And I was actually, I went to have a sleep study, all the things, right? That you go the wrong places because people don't look at you and you're 46 and you're still having your period. So they don't say, oh, this could be perimenopause. So that was really the impetus. I finally found a doctor in San Francisco. I drove an hour to get there. I paid $750 and I was sleeping within a week. And how crazy is that? It took that long, honestly, to improve my marriage, to improve my entire life. Because I didn't have the right care. So that's really the background of it. Then the question was, could there be a business? And my co-founder, Sharon Mears, and I had written a book together called Getting to 50-50 that had come out in 2008. And we always wanted to do another project together. So we started talking about menopause, and we got really fixated on menopause. But the question was, could you actually create a business from menopause? So we started like investors do. We did a landscape perspective. And we said, here's what's already out there. Here's what people are already doing. What's missing? And what we realized was really missing was insurance covered care. And that everyone was going about it from a membership model or from a subscription model or from selling you the product model. And they weren't going about it from, this is healthcare. This is not something that can just be solved with a product. It needs a discussion, it needs a collaboration, and it's healthcare. So that's really what our differentiator was to say, we want to start a healthcare company to deal with these menopausal issues.
So the statistics as well as we do, hundreds of millions of dollars raised around menopause, in the last couple of years. And lots of people have an idea, but they don't get tens and tens and tens of millions of dollars of financing, which you have. So congratulations on the latest round. What do you think really differentiated you and your partner as co-founders, or the business model? Because there are companies who are offering care now through insurance companies. What makes you stand out the way you do?
So we really built our company starting with care protocols. We said for every symptom that women go through in perimenopause or menopause, there are a lot of opportunities for care. There are supplements, there is lifestyle, there is hormones, and then there's non-hormonal medications. We spent a year basically mapping out for every one of the symptoms, here are all the ways that you can get solutions. So you don't come to us, we are not a hormone mill, we are not a subscription mill. We give you all the options. So it took a long time, and we went to the experts and we mapped out, basically it's this thick. I mean, it's all the different care options for all the different ways that you go into menopause. Are you going into menopause because of surgical menopause? Are you going into it because of cancer treatments? Are you going into it early because you're having premature menopause? Like, we basically went and did all the research, and we ensure that when you come to Midi, you will get the highest quality care. And that is our gold standard, is making sure that for all of the care, all of the symptoms that women go through during perimenopause and menopause, we will give you the best quality care based on all of the global research. And that care will be covered by your insurance. That is our value to women. And I don't think anyone else has done that. And I think it's why the company is growing so fast, is because we're really the only ones who are doing that.
You know, I'm so curious, and kudos to you, because this is definitely not something that your average GYN has expertise in necessarily, nor do they have the time to put into what's necessary for a full menopause consult. And you have a wonderful board of advisors, of heavy hitters, esteemed colleagues of mine. So I think that's awesome. But who's actually providing the care? And is it a replacement for the gynecologist, or in addition to the gynecologist? Like, what is the ease of navigation with that?
So we start with the care protocols, as I mentioned, and they were coordinated by Dr. Mindy Goldman, who leads the Survivorship Center at UCSF. And she is the keeper of the protocols. And we actually have a medical committee that then reviews each protocol and review and approves each protocol. And as we've added new protocols, they continue to approve those protocols. The care is delivered by nurse practitioners who are licensed in all 50 states. So now we have nationwide care. And then we have the ability to escalate care to specialists. So women will come in and they will have complicated cases regarding cancer or family histories or other complicated issues. And we then have specialists on the back end who are physicians that we escalate their care to, and we have consultations. So that way we're able to make sure that everyone is getting the highest quality care. You ask whether we're replacing your OBGYNs. Most women don't have an OBGYN. So we are not trying to say, go away from someone that you love. The vast majority of women coming to us, they don't even have a primary care doctor, let alone having an OBGYN. So
that's really a sad statistic. I'm spoiled because I practice in a very metropolitan area. So, you know, they're specialists for specialists. But I know that, you know, so many other fields of medicine are really foraging into the menopause space, internal medical doctors, you know, endocrinologists. So there's a lot of overlap. So I'm guessing that there's representation of all of those fields. But how is the follow-up accomplished? Is it just that people will make multiple visits based on their needs?
Yeah, and then we have specialty visits. So you can come in and start with a perimenopause visit, and then actually you want to have a visit talking about weight, so you can come for a weight visit, or you want to have a special visit talking about your bones and make sure we get you a DEXA scan and we can follow up on that. So we're building out additional specialties. So you'll kind of come from one type of thing, and then we'll make sure that you get the right care, either by that same provider or by someone else who's trained in your area of need.
Yeah, and what about for the uninsured? Since I'm imagining there's plenty of those types of consumers that are really looking for good care but don't have insurance. Is FSA, HSA acceptable, or is there, you know, is it a reasonable cost compared to the $750 you had to lay out?
Yes, we do have cash pay offered for our patients, and it depends on the complexity of care, but the visits are, yes, far less than the $750 that I had to pay. percentage of women paying cash pay is about 10%. So 90% of women are paying using insurance. And if you do pay with cash, it is reimbursable by FSA.
Okay, great to know.
I'm curious, you always need that first customer and, the first insurance company or the first employer. Are you at liberty to share who that was and what that did to your business? Because, you live in Silicon Valley. No one wants to be first. They don't want to make the first investment, but they want to make sure that some of the risk is taken out. Who stepped up first and said, yeah, I believe you. This is a real business filling a real need?
Well, so first of all, it was our women patients. They have to start with them. So we started a pilot. We recruited 50 women to come to us, and we took care of them. And we asked them to commit to 5 visits, and we learned from them a lot on how women want to be taken care of. How did they want our onboarding to look? How did they want our emails to look? We learned, for example, that people initially felt like we were asking them to take hormones too strongly instead of giving them the option of not taking hormones. We learned that everyone wanted lifestyle integrated into every one of their care plans. So what we did was we started with the women, and I think that is the key to why our company works. It is designed around women. They all lived in California, but they were a diverse group of women in perimenopause and menopause, and they were also of different ethnic backgrounds. So we really did a lot of work into that. One thing I'm incredibly proud of is our culturally competent care. We have done all the research on how women who are Black, women who are Asian, women who are Hispanic might have different experiences of menopause. And all of our providers have now been trained on how to treat people with cultural competency. So we learned all of that through our initial pilot of 50. And then we opened it up and we got 200, and we treated those 200 women, and we called every one of them and we asked for feedback. What worked? What didn't work? How can we change the care? We learned some things that were actually kind of complicated. For example, most GYNs do not believe you need to have blood tests to take care of menopause symptoms.
You just read my mind.
Okay. Women really want the blood tests. And they would get very angry at us for not offering the blood tests. And we would actually get notes, well, I'm not sure that I trust your care because you are not offering me a blood test. So that is interesting, right? So how do you take care of women who say, I want the blood test and I need it? And we would say, but you don't actually need it to get the care. But we're happy to get it for you because maybe we'll find out that you have diabetes. Or maybe we'll find out that there are other things that are going on. So just using that as like one example. Or, women also really want to be offered choices. So they want to not be told, you have the BRCA gene, here is what's appropriate for you. Instead, they want to be told, you have the BRCA gene, you can choose this course, you can choose this course. You do the cost benefit analysis and we'll work with you on that, but we want to let you choose. So that's another thing we found was really important, was giving women options and letting them choose. Same thing actually on cost, right? You might always assume that women don't want the gel for their estrogen because it's more expensive. We don't assume that. We've learned not to assume. We've learned to say, would you like to pay X not for your insurance covered product, or would you like to pay X and get the other? So we're very much about letting women control the type of care that they want. And we really learned that from the patients that we started with.
Yeah.
So until we took care of 250 patients, we did not open to the public.
So here's today's hot flash. Companies helping women better deal with menopause symptoms raised $230 million in equity funding in 2023, and this accounted for over a third of all women's healthcare funding. You've struck so many nerves for me because I'm a practicing clinician. Of course, I think the biggest limitation for all of us is time, and it seems like hopefully your practitioners are happy and not pressed for time in terms of restrictions and how quickly they need to get through things. But I am curious because you're evidence-based in the offerings that you provide. You've got really, really esteemed physicians and healthcare providers who you're working with. But yet some of the things that women want and that I note on your site that you offer are not mainstream or quote unquote necessarily recommended by the Menopause Society or evidence-based enough for them to put in their position statement. How do you navigate that? How do your practitioners navigate that? Because I find it difficult. And this question emanates from the blood work. If somebody asks me for blood work, I know it's not going to make a very big difference, particularly these specific hormone tests, but it's easier and just more satisfactory for my patients to just get it. Maybe it will add some information, even though it's not quote unquote evidence-based or recommended.
It's a great example, right? I mean, the blood test is interesting. We got an email today from a very unhappy patient who said that your provider was willing to give me hormones without a blood test. I don't believe she knew what she was doing. And
she did, but that's okay.
She did, but that's okay. That's exactly right. So you know what? We're learning a lot every day. We're learning how to have those conversations with people. If you want the blood test, you can absolutely have the blood test. It is perfectly great to have the blood test.
I was going to flip this question around a tiny bit, if you don't mind. Are your healthcare providers happy?
We are working very hard to make them happy. We find that we have women all over the country working for us. They have longitudinal care with their patients. So almost all the other telehealth companies are basically pushing buttons. They're not actually having longitudinal relationships with their patients. We find there's a lot of a lot of provider satisfaction in having real relationships with their patients.
Joanna, excuse me for interrupting. For people who don't know that term, longitudinal relationships, can you define that for those who are listening?
Yeah, it means that you have the same relationship with the provider who gets to know you and takes care of you. So you have that same provider every time you come back. Think of it like a therapeutic relationship as opposed to a transactional relationship.
It's such a good example, because if you found a therapist, you would not want to go to a different therapist month 2 versus month 1. So, and I think that's really an important distinction, because while telehealth has a lot of benefits and it's convenient, that is different than a relationship.
That's right.
Well, I bring it up only because, we see so many retirements and frankly, a lot of misery in the healthcare field because people are burnt out or just unhappy with their situations. So it's good to hear and very refreshing.
I think we're the recipient of that burnout, quite honestly. We have a lot of people, mostly women, coming to us. They want to work from home, which is a great option for them. We have longer visits. So they, in the regular hospital system, they're seeing 6-minute visits. It's not enough time to have a real relationship. So our visits are much longer. And we're doing a lot with technology to make their lives easier. So we're using AI to record all their visits, to make the charting easier. We're doing a lot to try to make their lives as simple as possible. I'm going to tell you, it's not all easy. We do prescribe, as I mentioned earlier, weight loss medications. The insurance companies are making it as hard as they possibly can to fill out pre-auth forms. And it's such an extra burden on our providers to have to fill out these forms, especially when they know the insurance is probably going to turn it down anyhow. So we, we're working on making it easier and easier for them, but the system does not make it easier for them. So we have to use technology to do that.
Yeah. So 2 questions. You started with consumers, and listening is the most important. And that is so clear in all your communication. You're doing the opposite of gaslighting. We're believing you, we're listening to you, we're working with you. So talk a little bit about how you've been such an important part of the changing conversation and dialogue, sort of in the system, not just in Midi, but people who have been in it for a long time know that menopause isn't new, but to a lot of the world, it looks like it just was discovered in 2020 or 2021. And Midi has been one of the leaders of that conversation. So how does that complement what you're doing on a day-to-day basis? Because that is so critical, to have a language, to have a discussion with insurance companies, with employers, and with patients.
Yeah. So you might think that menopause is having a moment, and it is, right? It's still early in that moment. Yes. Those of us in the industry see it a lot, but the average person isn't really paying attention. I think having people on Instagram have started talking about they're in peri, which is great. Like it's, it's kind of it's early discussion about peri. But I think we're still actually very early in this. So we need to have it's probably a worldwide discussion, not just a nationwide discussion, about the fact that women really have historically been undertreated and under-researched. And so there hasn't been enough attention paid to women's health issues. And I think a lot about when the Women's Health Initiative came out and they stopped prescribing hormones, the percentage of women on antidepressants went up 6x. So that's pretty significant, right? So I think
without any awareness of what the consequences of that set of choices would be.
That's right, because then actually it brings down your libido, and that is like,
Yeah.
so there's like so many things that are all tangled up. And so I just feel like I have to shout from the rafters. Like it's where I wear my t-shirt that says menopause is hot wherever I go. And
I love it. I've seen you post on it many times.
I go to the supermarket and I'm wearing it, and the woman like at the checkout counter, she's like, it is, right? Or like I think women have been very secretive about this. And so I feel like we have to be just kind of brave and say, look, this is real. And honestly, I tell people that we're a marriage saving company, and they're like, what? I'm like, do you not know how many women are going to therapy unnecessarily or marriage therapy unnecessarily? Like, there's a lot that happens in women's lives that can be helped, but you have to talk about it first. And so I just think a lot of what we need to do is just shout this from the rafters, that there's a lot going on in your body and there's a lot that isn't known, but there is a lot that's known, and you can get treated for those things.
I think you're totally right. Sometimes you feel like you're in an echo chamber. Every day someone calls me and said, did you know this about menopause? And I refer them to Alyssa. I'm not a healthcare practitioner. I say, I know enough to be dangerous. So I have two more questions, and then we want to let you go. The first is, when you went from listening to patients to talking to employers and insurance companies, how did that transition come about?
So actually, I want to say that my North Star is still patients. And I actually have to say that really strongly, because I've had some pressure from employers and insurance companies to change some of the things that we do, and we will not do that. So fundamentally, I'm a consumer company. I'm serving the women. The question is just how it gets paid for. It's
Right.
not, but we will not change our care at all. And that is truly my North Star that I feel very strongly about. And by the way, there's not a lot of companies that are doing that. So like, it's very hard to hold that.
There's a great line from Hamilton that I always love, where they say to Aaron Burr, if you stand for nothing, Burr, what do you fall for? So this idea of standing for something is so important.
Well, that's your distinguishing factor also, whether it's sales of products or whatnot, you're considering the consumer first, the patient.
So let me be really clear. If you sell to employers and you sell menopause care to employers, one thing that other companies do is they say, we'll keep your women out of doctors. So we'll give them coaching and we'll coach them. It's not taking care of them, right? But then they say, we're going to keep them out of doctors, so we're going to reduce your costs. So that is a value prop to employers. That's just not a value prop to women. But if you're mostly selling to the employer, then that's what you're going to prioritize.
Well, it's just so interesting because there's one conversation to the patients, which is about care. And then there's a business model, which is as you said, how do you get people to pay for it? So for those who are not in the middle of the menopause vortex, how can people find out about you, see if their employer or insurance company covers Midi services?
Yeah, so it's really clear. You just go to our website at joinmidi.com. If you click on insurances, we'll tell you all the insurances that we cover. By the end of this year, we will have 70%, maybe even more, of the PPO population covered. So we have 50 states right now with United. We will have 50 states with the other large companies. And so I'm pretty confident that by the end of this year, we'll have the vast majority of PPO patients covered. And then the goal is to expand to Medicare and Medicaid in 2025.
Amazing. Well, sounds like you have momentum, and we're cheering for you every step of the way. And thanks so much for the work that you're doing and for being willing to share
story.
your perspective. It's so this is one of the reasons we love doing this. I always learn from the people, even though we're both talking about women's health all day, every day. So thank you so much for that.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.